Okay.
Okay, so this is a spotlight interview with Kelly R. McKinley. Um, I'll begin with what is your professional background?
Well, I am a mechanical engineer that was thrust into the crisis management profession about 25 years ago. I got an engineering degree from the University of Kansas, and then I did engineering consulting for about 15 years, and then I came to New York. I worked in New York City government at the New York City Health Department. And then on 9/11, I went to the New York City Emergency Operations Center. I worked there for about 10 weeks, and I've been in the crisis management field ever since. I worked for the city of New York at the New York City Office of Emergency Management as deputy commissioner for about 9 years. I went to the American Red Cross as the chief disaster officer, and now I'm here at NYU Langone, and I've been here now 10 years.
May I ask, what made you decide to study public administration after studying mechanical engineering?
Yeah, it's a good question. Uh, Engineering is about problem solving, and I enjoyed it, but the problems that you solve in engineering are very focused. They're very specific problems, and um, like I don't know. Just to give you an example, there was a building. It's the old Pfizer headquarters that's just up the street from where I'm sitting. I'm sitting on the corner of East 34th Street and First Avenue in Manhattan. And on 42nd Street, just up the street, there's the Pfizer headquarters that Pfizer has sold the building. They moved out, and they're converting it into condominiums. And there was a cutout of the building that they wanted to fill in with more floors for these condos. So they built this, essentially built a smaller building and placed it within that cutout. And so to do that, you need to do a lot of structural calculations. You have to shore up the steel, and they did that, but the design wasn't reviewed, and then the contractor didn't build according to the drawings, and so that building started to buckle, and there was a big incident last week where they had to evacuate a big area of Midtown Manhattan because that building was essentially going to collapse.
Yeah,
And so you remember that?
yeah, I do.
Yeah. And so I was affected because we have a very large facility just across the street, and so our that was an incident that we were involved with. But so the engineers, it's a very big engineering problem. That's about as big a problem as engineering gets, hopefully. Um, but for me, and I enjoyed problems like that, but I wanted to work on bigger problems that affected people directly. And so government is, accountable to people. And so I wanted to work in government. I wanted to do things that big things that help people. And so that's why I got my public administration degree.
Next question. What first sparked your interest in public health? So did you have like
Sorry, I just closed my door.
okay. What first sparked your interest in public health? So did you have like a specific event that inspired you?
So when I went into after I got out of college, I went to work for a large earth mover tire factory and as a production engineer. And I did that for about a year. And I didn't like that. I didn't like, the environment, and I didn't like the work. And so I went to the Peace Corps, and I was in West Africa in Cameroon for 3 years and to sort of reset. And when I got back, there really weren't any mechanical engineering jobs, but there were jobs in environmental engineering. So my work was really in environmental engineering. And so I did a lot of what's called industrial hygiene work, which is human exposure studies, and I did hazardous materials, soil and groundwater remediation. So I was in the environmental health business, and that's how I went to the New York City Health Department. I was the associate commissioner for environmental health at the health department, and it was the Department of Health then. This was 2001, and it was just called the Department of Health, and it was a really amazing place to work.
Mhm.
It's the first municipal health department, I think, anywhere, and it's the oldest, and it's quite large. I think there are about 6 or 7 thousand people work there, but it was really an amazing place. All of the ways that these different professions came together, and what they did for public health and the variety of things that they worked on was really incredible. I mean, they do everything from infectious disease, which is a big part of what the health department does. I mean, they were originally created to battle epidemics, right? And I don't know the year they were created, but New York City is a port city, and if you ever look at an old picture of or an old drawing of New York, the whole of Manhattan is ringed by piers, and these ships would come in, and the sailors would get off, and sometimes these sailors would have God knows what diseases. And there would be, next thing you know, there's an epidemic raging through, in the neighborhoods of Manhattan. And so the city, leaders, the elected leaders said, we got to put a stop to this. And so they created the health department, and they gave it, some power. They gave it what are called police powers. They're not policemen, but a lot of the officials at the health department carry badges, and the reason is because they can seize things. They can take people's rights away. So, for instance, when I was the associate commissioner, one of my offices inspected all of the restaurants in the city of New York, and all of the school cafeterias, and all the hospital cafeterias, and all the prison cafeterias, and even the street vendor carts were inspected by my office once a year. And so if we went in there into a restaurant and we saw some egregious violations of the health code, we could actually shut that restaurant down on the spot. And so that's taking the rights of that restaurant owner away, but we had the power under the law to do that, to protect the health of the public. And they would do some, back in those days when when they had those epidemics, they would actually embargo and close down entire city blocks, and they would get everybody out, and they would throw the bed sheets into the street and burn them. I mean, they would take these very aggressive actions to stop these epidemics, right? And that's really, I think, what people, I think this notion that you have these risks of pandemics, and you need this organization to protect the public, I think is super important. But there's, as there's so many aspects to it now. I mean, it's not just infectious disease; it's chronic diseases, and it's and the health department now, it's not called Department of Health; it's called Department of Health and Mental Hygiene. So it's taking account of the mental health side as well, which is super important.
Uh, so what are some values you have as a board member of crisis management and preparedness committee? So in other words, how do you approach crisis management?
Um, for me, I'm doing this a long time, and there are lots and lots of things that can go wrong in this life, right?
Yeah.
And as we sit here today, in 2026, I'm doing this now 25 years since 9/11 was the day I got into this business in, September 11th, 2001. And it's actually more, I think, the threat environment is actually more extreme today than it was even then, right? There's so many societal factors that are converging now, and so many risks. If you think about uh, the economy, for instance, and you think about the geopolitical issues, you think about the way the sort of the post World War II multilateral system is breaking down, and now it's what they're talking about, this unilateral system across the globe, and the great power politics, and U.S. versus China, and the wars that are happening now, and politics as well. What's going to happen with the midterms? What's going to happen with the elections? And the left versus right, and it's the polarization of the body politic. And then there's this overlay of technology. Everybody's talking about AI. What is AI going to do? So all of these things are converging now, and so the risks are high, and the risks of catastrophe are, in my mind, are high. And so I wrote a book about catastrophes, and because I've experienced a few. I think that 9/11 was a catastrophe. COVID-19 in many ways was a catastrophe. So I have some familiarity with them. And, it's our job as crisis managers to be ready for them. And, a lot of people will think, well, what you need to do is you need to get the public ready. You need to convince the public that these things are going to happen, and you should make them prepare. And in my mind, that really is it's sort of wasted effort, because people don't do that naturally. It doesn't come naturally to them. They don't like to do it. They don't like to think about those things. They don't, write their individual preparedness plans. They don't get go bags, in my experience. So, but that doesn't mean that we don't have to be prepared, and we don't have to have our teams ready, so that when they do happen and people are cast into that world, we're there for them, and we can guide them, and we can tell them what's happening, and we can solve those problems. So it's a hard job, and there's not enough of us, and we're sort of, after COVID-19, we're sort of, the industry of crisis management is sort of disempowered a bit. So we have a lot of work to do to sort of get back to full strength.
So do you think that it's better to approach like crises with like by seeing what resources you have right now, instead of like convincing the public to prepare?
I think you have to try. I think those public education campaigns are important
Mm.
to explain to people, what to have in your head, what to have in your hand, what to have in your home. Like in your home, you have at least 3 days of shelf stable food, and you have spare water, and you have flashlights with batteries, and you have transistor radios, and you have these large supplementary power devices that they sell now, and then also that to have a plan to think about what they would do if there was a situation where they had to get out of their home immediately, like a fire. So that, like a go bag, have a go bag with your essential papers, and if you take prescription medications and that sort of thing. So it's important to educate people about that. I think some people will do that, but the proportion is very small. But still, it's important for us to say it, and especially because some people will do it. And then the other thing is, sometimes we get some forewarning. We understand, we see that things are happening, and so more people will take the time to prepare. The data shows that the people who prepare for disasters, by and large, are people who themselves have experienced a disaster, have personally experienced something. So, for instance, if your home was hit by a tornado, that person, after they rebuild, they're highly incentivized, and they will prepare. But if you're next door to a home that was hit by a tornado, statistics show that you are less likely to prepare. So it's not enough just to see it. It's not enough that somebody was impacted. You yourself, you have to feel that pain, right? You have to feel that chaos in order to be incentivized sufficiently to prepare.
That's interesting. Um, you already touched upon this with talking about 9/11, but can you share your most notable or memorable experiences that you had throughout your career?
Yeah, so 9/11 was probably the most memorable, and the health department headquarters were downtown. They were just north of the World Trade Center, so I was going to work. It was just a little before 9 a.m. in the morning. I was walking out of the subway at Church and Chambers Streets, and uh, it was just quiet, and I was like, super crowded, but it was there. What you could hear a pin drop, you could hear the wind blow, and I was like, what is happening? The cars were stopped in the street, and the doors were open, and the drivers were standing beside the cars, and everybody on the sidewalk was just standing there, and they were all looking up. So, of course, I looked up too, and there was just this gigantic black gash across the north face of the World Trade Center, and because it was just a block and a half away, so it's almost like looking up at a cliff, um, and so that was really where everything changed for me, and I turned and walked back. Our office was just a couple of blocks away. I was standing there. We were all looking up at the tower, and it was burning at that point. And then the second plane hit. So this just enormous explosion. And so that's when, we were just cast into the middle of it. And it was really like, 24-hour days for about 10 months from that point. But um, that's when I got into the business. And then, the night Superstorm Sandy came in, that was Monday, October 29th, 2012. And we had been working I was the deputy commissioner then. My team was running the emergency operations center, and we'd been working for a week, for that storm. And then it finally came in that night. And I was we have this, what's called a watch center. It's like a control room, like a mission control. And it has, police radios and breaking news and phones, and everything just lit up, the cameras and the radios, because the storm was coming in. And people were trapped in their homes, and there was water rescues going on. And then there's a place in Queens, just at the tip of the Rockaways, called Breezy Point. Breezy Point was on fire, and so it was just absolute chaos. But we knew that it was going to be chaos. We'd been working for a week to prepare for that moment, so we kind of just, we just got into the zone. And then again, there was another, sort of 10 months of hard work from that point. So basically, my business is really about work. It's, when I see a disaster, I really just think to myself, how much work is this going to be for me, right? um, that's ultimately the calculus.
Okay. So as a public health leader, what do you think are the most important aspects of disaster response and recovery? What do you think are the most important components? Do you for example, I know that some people make sure that like vulnerable populations are most prepared, or like for like do you focus on long-term recovery?
Yeah. So the most important thing is really trust, you know, because people are in their homes and they've been sort of cast into this alternative reality, right? This parallel universe. And so, and there's all these voices. They're trying to figure out, who's in charge and what should I be doing and how, where do I get help? And so, that they need a trusted voice. And, when I was the Red Cross, we were a trusted voice. People see the Red Cross, they know what it is, they recognize it, they trust the Red Cross. But the Red Cross can't be everywhere all at once, and especially in a big disaster, there's just not enough of them. Government has to sort of pick up the slack, and people have to trust that government is there for them. They have to trust that the government has their back, and I think that part of it has really changed maybe over the last um, 5 to 10 years. I think the trust that people have in government has changed, and so that's our biggest problem. I think trying to convince people what they should do, or trying to convince people that that the government can help them when they need help and how to do that. I think that's a really big problem that we have. New York City is probably better. I think I think this government is does a lot. They and the way you get trust is you talk. You talk to people. You get out there into the community. You just keep talking, and you keep and people have very good judgment. They know, especially in New York, we know truth from lies. We know when someone's lying to us, and so if you have a mayor that talks and talks, and people trust that that mayor is being truthful, that goes a long way. I think we're kind of there now. I hope we are, but it's still it's a day-to-day job. I mean, in this business, you're only as good as the last job, and you're always one job away from failure, right? So COVID was a failure nationally. I think the mayor here did a pretty good job. I think the governor did a good job with COVID in New York, but still there was so many voices coming from Washington that were just absolutely bonkers. And still, in terms of public health, the messaging coming out of Washington, the voices coming out of Washington are just, I mean, it's I sort of can't talk about it too much because I get really sort of animated, and I get on my soapbox. But when I was at the city health department, you know, we we had a we had processes, we had protocols, we have ways of thinking, ways of working, ways of talking to people, and they were honed by decades and centuries of working in this business and knowing what works. And that was in Washington. It was all thrown out. They just the way they do things is just it is just anathema and just and opposed to any kind of effective work. I mean, during COVID, like I teach it at NYU, and I show some videos of the president during COVID, and he came on and he did this press conference, and he was talking about how chloroquine, which is this malaria drug, is going to cure COVID, right? And
Hmm.
he said, I think it's he goes, I don't know, I'm a pretty smart guy, and I don't know if it's going to work, but I think it could work, and I think we should give it a chance, and and is and you know, I just think about my days at the health department. These docs would have just been, they'd have just been, their brains would have melted, right? It's just crazy.
Mhm. So, so you're saying that communication is really important when conveying trust.
Yeah, it's everything.
Hmm.
It's really everything. And when I was just one more story. When I was at I worked on the health and safety issues at Ground Zero after 9/11, and I was working alongside all of the federal agencies and EPA, and then we're there, and you know we twice a day we'd have these health and safety meetings, and there'd be hundreds of people working on these things in the room. And we got word that the EPA administrator had been on television and had said, I'm happy to tell you that the air is safe to breathe and the water is safe to drink. And so we all went, what? Is like, she said, what? The EPA administrator? And because when I was in the health department, we never used the S word. We never said safe at the health department, because safe is a scientific term. Safe, you need just a enormous voluminous data to say that something is safe. You can say a lot of things about something, but to say it's safe to the public means that there are no risks to this thing. And to say that the air is safe was absolute. They had no data, no justification to say that. And for 25 years we've battled that because it wasn't truthful. And the outrage that caused, and the damage that caused, is incalculable. And she's never lived that down. I mean, she's apologized for it, but it was so destructive. To lie to people. I don't think she thought she was lying to people. I think she thought that she was. You know, I think she thought that, hey, it could be true, but uh, it was, it was ultimately, it was just horrific in terms of public health.
So the next question, what is the current public health disaster you're most concerned about?
Well, I work in healthcare, so we worry about a lot of different things. We're having a disaster exercise on Monday about bioterrorism, and so we're worried about the ability of artificial intelligence to put more of these threat agents in the hands of bad actors. And New York City is very vulnerable to that. So we're worried about that. Um, you know, Shortly after 9/11, 9/11 was September. In October, some people sort of forget, but there was a bioterror attack. There was an anthrax
Anthra.
attack
Mhm.
on New York City, and that converged with the 9/11 stuff. And that's a whole chapter in my book. But no one really, I mean, they never really um, found out who did that. They have suspects. They think that they know who did it, but they don't really know who did it. So, but that was a horrific event. And it could have been much, much worse to have these very high quality anthrax spores released into New York City. Is a huge hazard for us. And so, but there are lots and lots of other bioterror threats. And so that would be a government-led response, and the hospitals would be significantly impacted. And a lot of it would be, how do we protect ourselves? How do we protect our healthcare workers so that they can continue to provide that patient care? And so that's a lot of what we work on.
And finally, what do you hope the future of public health will look like?
Well, I'd like to sort of get back to where we were with it. I think we were, the United States. I don't know if everybody agrees, but we had a pretty good system. I mean, the CDC was an amazing organization, respected throughout the world, and led public health development in the developing nations. And they had this epidemic intelligence service, the EIS, which would drop into these countries where a potential epidemic was happening and help to turn it around. And we had ways of working on messaging. We had ways of coming together so that we had one clear voice. um, you know, we just got to get back to that. I don't know what kind of damage has been done to the world. I don't know how we get back. It's like, you walk into the woods, you walk a mile into the woods, you got to turn around and walk a mile back out. So I think we got to walk a mile and we got to get back to where we were. The threats are worse, but we have more tools, we have technology tools, but it's going to take leadership. There are a lot of good public health leaders out there. None of them are in any position of authority right now, unfortunately. I mean, the people in Washington, at a national level, you, you scratch your head. You're like, where did they find these people? I mean, I think one of them was a television talk show host. The other one is a lawyer, but I don't, but and then you just like you see what they talk about, and you just, you know, like I saw the HHS secretary the other day, and he was on. He shouldn't talk, first of all, but he was on an interview, and he was talking about his diet, and he said, what did he say? He said, all I eat. He goes, I'm on a carnivore diet. All I eat is meat and fermented vegetables. This is the top public health official in the United States. All I eat is meat and fermented vegetables. I mean, it's just, you can't make this up. You cannot make this up. It's like, oh, if you thought, well, what's the worst, just in terms of diet to people, what's the worst thing that the top public health official could say? Well, they could say, look, just drink whiskey and nothing else. That would probably be the worst. But the second worst is, you know, uh, meat and fermented vegetables. It's like, is that a good diet? And by the way, is there any data? Is there one freaking data point about that? No. So anyway, see, that's what happens when you ask me a question. I go off on a tangent. I don't even remember what the question was.
Are you optimistic about the future of public health?
Oh, I am an optimist. I am an optimist. But and it will get better. It has to get better. It has to get better. But we got to get back. We have to get it back. And the stuff that we teach in the schools, that's don't anybody think that that's not correct, because it is correct. That what you're seeing now is not. And it's not just that it's not correct. It's not like it's the way they're doing things is a legitimate alternative that we should consider. These are not, and I'm just saying this as it from an objective. It's objectively wrong the way that they're approaching these things. And like what they're doing with vaccines, and the thing that they're talking about vaccines, it's just that it's not like an alternative viewpoint that has validity. It has no validity.
Mhm.
Their approach to vaccines has no validity. So anyway.
Okay, thank you. So that's the end of the interview. I'm gonna stop recording, but we could chat later.